Hi, welcome to Shobbs Health and Wellness Podcast. Today I have a guest on the podcast with me, and her name is Nurse Jennifer. She's a registered nurse, and Nurse Jennifer has a wealth of knowledge and experience when it comes to cervical cancer. I'm so excited that she will be sharing her insight with us today. So we'll be talking about cervical cancer. January is the month for creating awareness for cervical cancer, and that's why I have to bring Nurse Jennifer on the podcast so that she can share insight with us about this topic. Welcome with me, my guest for today, Nurse Jennifer. Hi, Nurse Jennifer.
Hello, Sarah. How are you doing?
I'm fine. How are you doing too?
Awesome. I'm so happy to be a part of your podcast and also share my knowledge on cervical cancer and create awareness. January is the month for cervical cancer awareness, and of course, doing this with you, it's exciting and it's just amazing to create a change.
Wow, amazing. I love that word. Okay, so I know I didn't really introduce you properly because I want my listeners to get to know you more. So can you just introduce yourself briefly to us?
Okay, so I'm Jennifer Akpata. I'm a registered nurse, midwife, and also a certified family planning provider. As a nurse, I've worked both in the clinical and non-clinical area. I've worked as a nurse in the hospital and also a nurse and a program coordinator for NGOs, that's non-government organizations, with one aim or the other in reaching people in the rural area. So my passion is basically about women's health, and this has grew over the years to be a strong passion, and just me wanting to do more to help women live a healthy life that they can maximize their future. Like I always say, women can do a lot of things, and it's my role to ensure that their health is usually better as they go about running their businesses, becoming that career woman they dream of. So it's a future forward female thing, and so it's really just doing my part to ensure that women are healthy.
Yeah, I love that word, future forward female part. So, women helping women to be able to manage, get adequate information about diagnosis or this topic we're talking about. And I'm happy that you are there to create awareness. You are there going into the rural, to every community, just to get people informed about cervical cancer. A lot of people really don't know what cervical cancer is all about. So, Nurse Jennifer, I would like to ask that can you just briefly tell us what cervical cancer is all about?
All right. So, like you said, so because it's the awareness of cervical cancer, you see a lot of posts, designs, just saying get informed, get screened, get vaccinated, and some person listening or might just be wondering, what's this cervical cancer area I'm talking about? It can be the first time they are getting to know about this. So cervical cancer is just simply the cancer that affects the cervix. Now, if you're wondering what is cervix, is that even part of our body? Yes, so the cervix is the lower part of a woman's womb, that's the uterus, and it is this part that dilates. So you might have heard maybe in a movie, or you have a sister that has gone through labor and she'll say, I'm just 2 cm dilated, my cervix is just 2 cm dilated, or I'm 8 cm. It is the cervix that is dilating so that the baby can pass through, then to the vagina, and delivery takes place. So it's that cervix that we're talking about today that can be cancerous. So cervical cancer is just the cancer that affects the cervix, which is the mouth of the uterus or the lower part of the uterus where the baby passed through. Sometimes we say the neck of the cervix, the mouth of the cervix, it dilates during labor.
I know you have the statistics of rate of people that have cervical cancer, the people that were able to overcome it, and the people that actually affected. So I would like you to tell us the statistics of this diagnosis.
So because you don't get to hear about cervical cancer as we hear of other cancer like breast cancer, someone out there might feel, it's not really that prevalent, so I don't think people really suffer from this. The reality is that people are suffering from this, and sometimes they might not even know what they are going through. Like in 2020, there was an age of about 89,800 people, women, that were diagnosed of cervical cancer alone. That's huge. I mean, that's really huge.
Yeah.
And also 1,500 women died because of cervical cancer. So with that, hearing it or feels important, you can see that we're not playing, actually talking about something very serious. And even in Nigeria, there's a human papilloma virus center in Nigeria, and they've come down with like statistics to say that over 70% of cervical cancer cases are due to the human papilloma virus type. There are different types of human papilloma virus, but 16 and type 16, type 18 are responsible for cervical cancer. So you see that it's not like just a mere condition or maybe that just affects few people. It's really out there, and until women get to know about this, people get to know about the symptoms, what to do, getting informed, getting screened, getting vaccinated. Trust me, a lot of people keep dying in silence, just thinking maybe it's something else without knowing that this is cervical cancer.
That's so deep. All right, so Nurse Jennifer, can you enlighten us on the causes of cervical cancer?
So there are different, just like every other cancer, breast cancer, prostate cancer. Really, the main cause of cancer is not known. However, with cervical cancer, there are several things considered as risk factors. That's things that can put a woman at risk of getting cervical cancer, and one of that is the human papilloma virus. Now, this has been research have it also that this is the main cause of cervical cancer, and this can be gotten through sexual intercourse with partners who are, carrying the human papilloma virus. So, if a woman has several sexual partners, either oral, maybe she has oral sex, anal sex, vaginal penetration and all of that. If a partner is infected with the human papilloma virus and they don't have safe sex, she can get it from her partner. So one other risk factor is having many sexual partners. Another is having sex at an early age, and this has been known to increase the risk of having the human papilloma virus. Of course, all the drama that is around teenage sex, teenage pregnancy, not having protection, using condoms, and so that place teenagers at a risk, or adolescents at a risk of coming down with human papilloma virus, because first they have limited knowledge of this, and then they now also engage in unprotected sex, so that places them at a high risk. And also having other sexually transmitted infections like gonorrhea, syphilis, HIV, which weakens the immune system. So I remember having nursing a patient as a student who had cervical cancer. Now, the thing about this patient was that she was diagnosed, or she's a patient who has HIV. So she's a known HIV patient, and that's weakening her immunity, with also a history of having multiple sexual partners. So somehow, because the immunity is weak already, it's not able to fight, those viruses, infections. So it's more susceptible compared to someone who is healthy, doesn't have any underlying condition, or is not battling with an STI or so. So having all these other sexually transmitted infection can be a risk factor. Then smoking, So it's funny how smoking is linked with a lot of health conditions, like several health conditions, just name it. And here we have it. It's also linked with cervical cancer. So cervical cancer, I will come to it as we talk. It's linked with there are two types of cervical cancer.
Okay.
And smoking is linked with the squamous cell cervical cancer. So if a woman smokes, there is high risk that she will come down with a type of cervical cancer called the squamous cell cervical cancer, which is cervical cancer that affects the squamous cell. I know we'll have audience like both medical and non-medical personnel listening to this, so
That's
just try and break it down. So there are different cells in our body, and even in the cervix there are different cells, cilia and all others. So smoking will make that woman be at risk of having a particular type of cancer that affects the cells in the cervix. So these are causes risk factors of cervical cancer. Yeah.
all right. So I just want to pick a particular risk factor that you mentioned, which is the oral sex. So for couples that are married and the woman have to engage in oral sex with her husband, what advice would you give for that?
So we're talking in the context of marriage, right?
Yeah.
Sex between couples.
Yes.
And of course, if you're married to somebody, you should know the status of that person. You know, if the person has an STI, if the person, whatever condition that person has, you understand. So our advice that woman to ensure that if she's having doubts about her partner or wondering if she can engage in oral sex with her partner, then she can talk to the partner and both of them can get screened for all these STIs that we're talking about, you understand, so that she can engage in oral sex with a free mind and enjoy it. Because if she's not sure, and especially if she has suspicion of the partner being unfaithful and all of that, woman, I mean, I've seen patients that the man is HIV positive, but the woman is not aware, and they keep engaging in sexual intercourse, whichever form. Then the woman is infected, or she comes out with HIV. She's critically sick, and is on drugs, and he will tell you, I don't want to share this information with my partner.
My wife.
And the woman is wondering where she got it from. The case of the woman being infected or having HIV, and then you see the partner coming, oh, my wife is sick, what's wrong with my wife? Of course, you have to ensure confidentiality. You can't just give that kind of information to the spouse if the patient has not, given you a permission to do so. So you end up hiding the information from the partner,
And then you pity the partner.
Anyway, let's not dwell so much.
That's true. Let's just move on. All right. So I want you to tell us the symptoms of cervical cancer. I really don't want to. I just want it short and brief so that people can get the information they need.
So there are several symptoms that a woman having cervical cancer can experience. One of them is vaginal bleeding after sex, vaginal bleeding after menopause. Yeah, so bleeding between periods or having periods that are heavier or longer than what she usually experiences. Then having watery vaginal discharge with strong offensive odor, and this discharge can also contain blood, can be blooding. Then pelvic pain. Just notice that there's pain, or pain during sexual intercourse. So this woman would have known her body, the signs she experienced. She's familiar with her body signs, you understand?
Yeah.
So she's able to tell when there is deviation from normal. A woman who does not experience pain during sexual intercourse and then she just started having pain, she cannot even fathom why she's having the pain or bleeding when maybe it's not her first time sex or first time having sex or so.
Yeah.
So that's something to raise an alarm for, and not just keep quiet. Then also pain when urinating. So these are symptoms that a woman can experience, when having can experience. So now, who does it affect? What age range of women can come down with cervical cancer? So anyone with this, first of all, that person is at risk of getting cervical cancer, and women have cervix, you understand?
Yeah.
So it's a risk. However, there's an age range. So sexually active women age 30 to 45 are more frequently diagnosed with cervical cancer, and then the average age of diagnosis is about 50 years. So this means that women age 30 to 45 have high chances of, and they are sexually active. They are more prone to having cervical cancer, and the number of people who are diagnosed is within this age range. However, there's rare cases of women in their 20s, 25, 26, coming down with. It's very rare to see women in their 20s with cervical cancer. The age range it affects.
All right, thank you so much for that. So, can you tell us how cervical cancer can be prevented?
So, I know we talked about the risk factor.
Yeah.
And now, so with all that I've said about the risk factor, it's just like the flip side. The flip side of the risk factor is to engage in safe sex, to have sex with your partner. Please give protection, use condom, and get that person screened. You are sharing your body with this person. You have a right to say, I want to know your status. I want to know if you have a STI. Just get screened so that I know who I'm having, sharing my body with. So that's one way it can be prevented. Engaging in smoking, of course, you have to stop smoking. Get help on how to stop smoking, because that also places the woman at a high risk of getting cervical cancer. Then getting screened. Yes, I know we've seen a lot of publications, write-up, and all. See, there's no hard and fast rule about this. The thing for this year is get informed, and we talked about cervical cancer, the cause and everything, getting screened and getting vaccinated. Now to getting screened. There are two ways every woman who is sexually active should get screened. Pap smear, through pap smear, and also the human papillomavirus test. So for the pap smear, it's used to detect cellular changes, like changes in the cell of the cervix before the cells become cancerous. So as a woman, you don't have to wait till the cells become cancerous, or you're having all the symptoms we talked about before you say, I want to get screened or so. So one way is to get screened through pap smear. And this pap smear is done in the hospital by a healthcare professional. And how it is done is that the cells of the cervix, they just take like a specimen from the cervix and send to the lab where tests to be done to see if there's any precancerous changes, if the cells are normal. So that's one way to prevent cervical cancer. So who should do this test? So women aged 21 years and above, 21 to like 65, can do this cervical screening test. Now, I know I said that women aged 30 to 45 are more prone, or they are frequently diagnosed for cervical cancer. However, if a 21-year-old woman is sexually active, then she doesn't have to wait till she's 30 or 40 to get screened for cervical cancer.
Yeah.
Women aged 21 to 65 can do this test.
65.
However, there is a frequency with different age range. For women who are 21 years to about 29, they can do pap test alone every 3 years. So if a woman does for this year, which is 2023, like maybe the next time she'll be doing is in 3 years' time. You understand? Because she's within the age of 21 to 29. Then for women within the age of 30 to 65, they have to do the pap test every 3 years also. But there's an exception. If they are doing just the pap test alone, then it's going to be every 3 years. But if it's combined with HPV test, that human papillomavirus test, then it's going to be every 5 years. So why women that are 65 years, remember I said the women that should do this test, 21 to 65. So for a woman who is age 65 years and above,
Okay.
she doesn't have to continue doing it at 68, 67. If the previous test has been normal, the previous pap test, previous HPV test, they've been normal, doesn't have risk, then it's not necessary to continue in the 3 years frequency or so. So remember I said it's 2 tests, the pap smear and then the HPV test. So I just talked about the pap smear. Now the HPV test.
Okay.
Now, when I was talking, I was the cause, I mentioned the human papilloma virus, and the HPV test helps to detect the presence of this virus, which causes cervical in the woman's system. And the particular HPV, cervical cancer, or increases the risk of cervical cancer, is type 16 and 18. So, to your question, which says that
Which of the tests?
which one should be done, the pap smear or the HPV? I would say do the two. That's what I'm going to say. If you're age 21 to 29, do pap smear. If you're age 30 and above, I will advise you do the two. I mean, if you do the two, it's even going to or increase the duration or the frequency you have to keep doing the test, like I explained previously. So, age 30 to 65,
Okay.
do pap smear, pap test, and the HPV test. When you do both, you can do every 5 years. You understand?
Yes.
So, pap smear, women aged 30 to 65 should do both pap test and the HPV test. For women aged 21 to 28 can do just the pap test. Yeah, so that's like every 3 years for that age range.
That's great. So you just mentioned the test. Where can they carry out the test? Can they just go to any lab, or there are some specific diagnosis center they can go to and do it, or they can walk into any health facility to carry out the test?
Any facility like who have like a women's health clinic, facility with women's health clinic or a family planning clinic, or obstetric and gynecology department
Yes, sir.
can run this test. And I know this varies for different facility, so we'll have to just check in with the services they provide also. Then I also know of some diagnostic, I know health tracker run some of these diagnostic tests, and HPV and also the pap smear test is also part of it. Then you can also go to the hospital. Some clinic, women's health clinic in particular, also do this. They run this test too, so you can also check just to confirm when they do the test, what you need to do when you're coming, if you need to register before coming for the test and all of that. Of course, when you're doing this test, you have to go after your period so that you can get a good sample. Yeah, so you can't take. It's just like taking a sample and then it mixed with blood, and also you have to go like maybe 5 days after the end of your period so that they can collect the sample and run the test.
Yeah, thank you. Thank you for the information. I actually did the pap test maybe like 3 years ago. I think it was 2021. I think I should be preparing for another one in 2024. And then I registered online, but I was directed to a primary health care center. So I think for the organization, they were using the primary health care center to carry out tests. People can walk in and you get the test done. So it's a simple test. You don't need to be afraid. It's something that can be done within 30 minutes and you're done. You're out of the facility. Thank you, Nurse Jennifer, for this great information. But I want us to talk about the importance of HPV vaccination in preventing cervical cancer.
The human papilloma virus vaccine is taken in 2 doses and can be taken by girls within age 9 14, and it's actually safe in protecting women against cervical cancer. This is why we scream and we shout and we do a campaign awareness, because it's so painful to know that something can be prevented. It's not like other cancer or breast cancer that there's yet to be a vaccine or so forth. Cervical cancer actually has a vaccine. The human papilloma virus vaccine that can be taken by girls so that they don't have to worry about being infected with HPV, that's human papilloma virus, or coming down with cervical cancer when they are adults. So it has been proven to be effective in preventing girls against the cervical cancer. Mothers need to know about this, fathers need to know about this, so that they can get their girl child vaccinated early within that age range. So that is when between age 9 and 14 is when they can take it.
Thank you for, talking about supporting, donating to organizations that support cervical cancer awareness. And I know that that's what you do. Your organization actually support, like you guys are there to create awareness about cervical cancer. So this is just a short way of saying that you can support Nurse Jennifer's organization. She has an NGO where, if I'm correct, yeah,
I have my first group.
yes, so where they create awareness about cervical cancer, and not just that, she also have a community. So if you're interested in a community, it's a close community where she enlighten people about different things on health. So if you're interested, she's gonna give us information at the end of before I end this. So you just have to follow her on all our social media handles. Tell us how we can follow you, or how we can reach out to you on different platforms.
Or well, thank you so much. I have like a group, a Health Matters group, and we are all about women's health. What we do, our mission is to support and promote women's health through health education, outreaches, innovative ideas, partnership, collaborations with brands of like minds who want to support women's health and ensure that women are healthy so that they can maximize their potential. And you can follow me on LinkedIn, Instagram. On LinkedIn, my name is Jennifer Akpata. On Instagram, my name is Akpata_Jennifer, lowercase. Then you can also join my community, that's a Health Matters group, where you get to information about different health issues that women go through with prevention. You also want me to your community, or speak to your community, you can also message me. My email is akpata, that's lowercase, akpata.jennifer97@gmail.com.
Yeah, thank you so much for joining us today, and we are looking forward to hearing more about your insights and experience on cervical cancer. We see what you're doing, and we're so proud of you. Thank you so much for joining.
Thank you so much.
Thank you, Sarah,
for inviting me.